Hello, my name is Kirsten Bibbins-Domingo. I am professor and chair of the Department of Epidemiology and Biostatistics at the University of California, San Francisco. I'm the vice dean for population health and health equity there, and I am also a general internist who practices at Zuckerberg San Francisco General Hospital. Last year, I chaired the National Academy's consensus report on integrating social care into the delivery of health care. We know that social determinants of health are important for overall health and health outcomes for our patients, but oftentimes as physicians we feel ill-equipped to meet and address the social needs of our patients. This report sought to provide a framework for physicians, for health professionals, and for healthcare organizations to address the social needs of patients within the context of healthcare delivery, as well as understand better the role of addressing social needs within the communities that these healthcare organizations serve. We are now in the time of COVID-19, and the pandemic makes painfully clear how important where we live, work, and play is for our overall health. And meeting the needs in this pandemic really means meeting and understanding how we better think about health and healthcare within the entire context of where health and this pandemic is currently happening. Currently, I chair UCSF's COVID Community Public Health Initiative. This initiative seeks to partner with the communities in the Bay Area and California that are most affected by this pandemic. Through these partnerships, we've been able to collect data, to empower these communities to use these data to advocate more strongly for the broader sets of supports that are necessary to effectively manage this pandemic in those communities. We've been able to partner with both local and state departments of public health to really use our data to help make the public health response more effective, particularly in the communities that are disproportionately affected by the pandemic. What makes me hopeful during this time is that I see a strong and urgent spirit of collaboration, of innovation, of thinking differently than we've done in the past, of thinking across sectors. And that makes me excited, it makes me hopeful, it makes me encouraged that we can think beyond just our traditional sectors that deal with housing or deal with food or deal with healthcare to a more holistic sense of the sectors that need to partner together to think about health in the community. What makes me concerned is that we need to think beyond just the urgent needs of the pandemic, and we need to plan for a future where this spirit of collaboration, the spirit of thinking across sectors on what's important to have an influence on health, especially in our most vulnerable communities, these types of supports and infrastructure need to be in the place for the long term to meet the broader health needs of the communities that we serve, not just the specific needs within the time of this pandemic. So I'm hopeful now, but I also know there's a long road ahead.